Hi, I'm Nicholas Andrade with Nightingale College, and this is my dressing changing using a sterile technique. As you can see, I'm in my Nightingale scrubs. I have my name badge. I have no jewelry on. My nails are clipped, and I'm in the appropriate school attire. To start, I'll introduce you to my supplies. I have here my wound that I'll be using, which has a bandage on it already. I have my sterile tray, which includes clean gloves. Inside of the sterile tray, I have sterile gloves. I have a new bandage, the transparent bandage, which as a disclosure, it is a makeshift bandage. My kit did not include one. I also have the alcohol swabs, which I'll be using to clean. Preferably, I would be using a ChloriPrep, but again, my kit did not come with one, so I have the alcohol swabs that I'll be using. I also have here my hand sanitizer, and I have a biohazard waste bag. So for the purpose of the discussion, some of these items have already been opened and used, but for the sake of the video, we would just go ahead and use new ones in the real world, so pre-disclosure there. So to start, I'm gonna knock on the patient's door, and I'm gonna introduce myself. Hi, I'm Nicholas. I'm the nurse that'll be taking care of you doing your wound changing today, doing the dressing changing, and I'm gonna start by sanitizing myself. And just to start here, I'm gonna go ahead and look at your wound. I'm gonna put some gloves on, but before we get started, I need to make sure that you are not touching the wound or touching any of my sterile supplies here. Wanna make sure that we don't cross-contaminate anything. This has to be a sterile environment. So to start here, I'm gonna go ahead and put some hand sanitizer on. I'll go ahead and apply the clean gloves by grabbing the inside and starting with my dominant hand, grabbing the inside and putting onto my non-dominant hand here. And I'm going to remove the current bandage that's on the wound. I'm going to start by peeling back towards the wound, working in and working towards the flow of the patient's hair, but I'll be running parallel to the wound here. And this is actually the first time I'm taking this bandage off since I put it on, so it is of course a little tight, but I'm moving towards the inside of the wound as I undress the bandage here. Being sensitive to the patient's wound, and I go ahead and dispose of this into my biohazard bag. And then I'm going to look at the wound, I'm going to observe it, I'm going to look for any drainage, any change in color. I'm going to see if there's any odor or discharge coming from the wound. And I'm also going to palpitate the wound, looking for any edema, and observe the wound for granulation and seeing how the healing process is currently going. So the wound, I've already looked at it there. It looks appropriate. I'm going to dispose of my gloves that I have here into the biohazard, and I'm going to go ahead and open my current sanitizing tray. And I'm also going to reapply hand sanitizer here as I get into the sterile environment. First thing I'm gonna take out are my sterile gloves, which of course, in the real world, these would be pre-packaged and closed. For the sake of this video, these ones have already been attempted from a previous video. So I'm going to make some room here as I unfold my gloves. Just gonna move the wound some, keep it within view there. And this of course is in a sterile space. So I'm going to start with my dominant hand, grabbing the inside of the glove as I put that on there, and grab the other glove and put this one on here. And then I'm going to, for this, I'm going to have this as my clean hand, this as my dirty hand, and this as my clean hand as I work through two different environments. One is the patient's wound, the other is the sterile environment. I have here my alcohol swabs that as I mentioned, would preferably be the ChloriPrep as I clean the wound, but for the sake of this, we'll go ahead and use the alcohol swabs to clean this patient's wound. And I have here, as I mentioned, this is in the sterile environment, so I take it with my sterile hand, and I haven't actually touched the wound yet, so both hands are clean. I'm going to take, with my sterile hand, put it into my dirty hand, and I'm going to go ahead and start with the inside of the wound. I'm going to work my way around the inside of the patient's wound. Through one pass, I'll go ahead and dispose of the now dirty swab into the trash can. And I say swab, but in actuality it would be a ChloriPrep. I would use one, as I do one pass through the inside and then a second ChloriPrep to go through the outside of the wound. So I'll go ahead and place with my sterile hand onto my dirty hand, clean the outside of the wound, one pass, and then I will go ahead and toss out the ChloriPrep. Then I will take my gauze from my clean sanitizing tray and put it into my dirty hand, and I'm going to pat dry, starting from the inside of the wound. I'm gonna do a pass around as I pat dry the patient's wound. All the while I'm still inspecting the area. I'm going to take the gauze and drop it into my waste bin there. I'm going to take a second gauze as I pat dry the outside of the patient's wound. All the while I am inspecting the wound, looking for the tissue integrity, making sure that there's no discharge or abnormal coloration. I'm going to, with my right hand, palpitate the wound again, looking for, of course, any edema or any changes to the patient's wound, such as the granulation and any changes in color. Next, I'm going to apply the transparent dressing. As I had mentioned, the kit did not come with one, so I have here my makeshift transparent dressing, which I'm going to apply to the patient's wound. And normally it has a border kind of going around it that I'll place here as I place it onto the patient's wound. It would have a border which I would then remove, and then I would take my Sharpie and I'd go ahead and write onto the patient's dressing my name and the date and time of the wound change, so that it is document visible for everybody to see who does come in after me and attempts the wound dressing changing. So after that, I'm going to reach for the inside of my glove with my dominant hand, then take my non-dominant hand, again reach for the inside, pull back, and then I'm going to clean my space here and toss everything into my biohazard tray. I'm going to update the patient, inform of any findings, let them know, hey, your wound looks good, it looks like it's healing okay. Do you have any questions for me? Patient doesn't have any questions, I'm gonna let him know I'm gonna return to the nurse's station. He has a call light here if he needs anything. I'm gonna document the findings. I'm gonna do one additional hand hygiene here, and then I'm going to tell the patient goodbye, and I'll close the door for patient privacy. And that's my dressing change using a sterile technique video. Thank you.